What's going on, health and wellness family? Health is King is back again with another video. In today's video, we are talking about the silent killer, all right, hypertension, otherwise known as high blood pressure, right? And the reason they call it the silent killer is because most people who have high blood pressure or hypertension don't have any symptoms, so they don't know they have it. But this silent killer affects more than half of the Americans living in the United States and disproportionately affects people of color. So it's important that we understand it and how we can prevent it. And to help us do so, we're going to watch a video about a family doctor who talks about high blood pressure and gives his take on what we can do to prevent it and some of the things that we should look out for. So without further ado, let's jump in.
People do not realize how serious high blood pressure is simply because most people that have high blood pressure do not have symptoms. It's called a silent killer because it can affect your brain, your heart, your kidneys without you even being aware of it. We know from studies that people that have high blood pressure are 4 times more likely to die from a stroke or to have a stroke, and 3 times more likely to have coronary artery disease as well. So when you get to your doctor's office, they take your blood pressure, and there are 2 numbers that they usually tell you. The top number is called the systolic blood pressure, which is the blood pressure when your heart is beating. The other number, which is the bottom number, is called the diastolic blood pressure, and that's the blood pressure when your heart is at rest in between the beats of the heart. And those numbers are very important. So obviously when you have a high blood pressure, it impacts not only your blood vessels, but your organs, in particular the brain and the heart, and it puts a strain on them. So people that have a prolonged elevation of blood pressure for years without controlling it, their hearts can get bigger. And as it gets bigger, it can fail, what we call heart failure. And so that can have an impact. And obviously on the brain also, very high blood pressure has a risk of leading to stroke, and that can lead to a lot of hassles and sickness and hospital visits. It's very normal for your blood pressure to fluctuate during the day. Your blood pressure fluctuates in response to anxiety, to stress, but as long as it doesn't stay high, it should come back down to normal. That is the most important thing. If it stays high persistently, then we begin to have problems. There are certain risk factors for developing high blood pressure. If you are overweight or obese, if you smoke cigarettes, those are risk factors. And if you have a family history, one or both parents, is also a risk factor. But there is hope. There is a way out, I've had patients who have made lifestyle changes and who have lost a ton of weight and whose blood pressure came back to normal. And these are the things we emphasize in primary care, that losing weight and eating healthy and making healthy choices day to day can, reduce your risk.
I want to highlight a couple things that he spoke about. The first being that high blood pressure can lead to heart disease and stroke. All right. Right now, heart disease is the #1 cause of death in the United States. So just managing and addressing your high blood pressure can reduce your risk of dying from heart disease significantly. Number 2, he mentioned that some of the risk factors for high blood pressure were being overweight and having a family history of high blood pressure. Being overweight can definitely have adverse health consequences, not just high blood pressure, but cancer, diabetes, stroke, and many other conditions that adversely affect our community and Americans. Something else that he mentioned that I think is important, that I always stress, is that hypertension is preventable, okay? With a healthy diet, a whole food plant-based diet, with moderate activity throughout the week and limiting your stress levels, you can prevent high blood pressure from occurring and happening to you. So if you have high blood pressure or know someone who has it, it's not a death sentence. There are a lot of things that you can do to prevent it, right? Go into your primary care facility to see if you have high blood pressure. Going to your doctor's office, maintaining a whole food plant-based diet, having regular exercise, managing your stress levels. Those are just a few things that you can do to manage your blood pressure and reverse it. But that is all I have for you all today. Do you know your blood pressure? If you do, is it high? Is it low? What are some of the things that you're doing now to address that? Let me know what you think. like, comment, subscribe, and I'll see you next time. Peace.